Tell me about yourself.
My name is Brandon Cromwell. I'm currently a senior in the clinical research program at UNCW, and I'm also pursuing my minor in psychology. I will be graduating in May of this year, which is very, very exciting. I'm very excited to enter the field of clinical research in order to help people live healthier lives. I currently work as an undergraduate intern at PPD and the Medical Affairs Research Operations, also known as the MARA Group, which deals mainly with late phase research studies. So the hands-on experience is very, very interesting.
What are your strengths and weaknesses?
I believe my strength is that I'm very detail-oriented and organized. I like to go above and beyond of what is expected of me, which I believe is a positive attribute for this position and in this industry. In turn, I believe that could also be one of my weaknesses. I am pretty much a perfectionist, and I sometimes expect too much out of myself, which again I believe could turn into a positive attribute in order to help build stronger relationships and to exceed the client's expectations and hopefully gain more work for the company.
Why do you want to work for our company?
Why do I want to work for PPD? That's a good question. After doing research about PPD online, I found that the main mission or objective for the company is to help people on a global scale live healthier, longer lives by delivering the life-changing therapies that they need. After gaining admission to UNCW, I shortly realized that I wanted to go into the healthcare industry for that reason exactly. I want to help people live healthier, longer lives, and for people who don't have options and don't have really much hope for treatment for their conditions, I believe clinical research is at the forefront of developing such therapies and can help people. I have family members who have been diagnosed with illnesses, and I believe that the future of clinical research could one day bring those potential treatments and stop certain illnesses from occurring in the population. PPD is a global CRO, so it would also allow me to help people on a global scale rather than just benefit people in a regional area.
I see on your resume that you have experience with regulatory documents. Can you tell me more?
Yes, the clinical research program has provided us with a large amount of regulatory documents in which we are able to review and gain an understanding of. We know what ICF forms are, 1572s are, curriculum vitae, investigative brochures, protocols, etc. I was lucky enough to have the opportunity to shadow a principal CRA during a local monitoring visit for a study in which I was able to review informed consent form for patients. We did source data verification against the EDC system. We had the opportunity to go to the on-site pharmacy to look at the investigational product accountability log. And we also had the opportunity to look at the delegation log, which is very, very important attributes and regulatory documents for the study. So that was very, very interesting.
Tell me how your time in the UNCW Clinical Research Program has prepared you for this position.
Being in the clinical research program at UNCW has been one of the better things that I've done for myself. The coursework I have endured during my time in the clinical research program has provided me with a strong foundation and understanding of the industry. I have my certification in good clinical practices as well as pretty much extensive knowledge with the Code of Federal Regulations and ICH guidelines. My data management class gave us the opportunity to work within an EDC system called Metadata Rave, in which I also received my certification in, which I believe will help me in my future career endeavors. The clinical research program also taught us the importance of deadlines and making our work of publishable quality, which I believe is instilled very much deeply in myself. We had to have a strong foundation of scientific classes. We have a pretty extensive knowledge of the human body as well as medical terminology, which I believe will help me be successful in the clinical research industry.
Do you have any questions for me?
I do. I have one question for you. I would like to know how your company or even yourself would define success for this role.